This Newsy original series is presented in partnership with AccuWeather.
We think that there may be other neurological disorders that are caused as a consequence of Zika, and we don't know all of the potential effects. We do know that they are serious.
Pues ahorita que apenas llevamos 3 días, pues ya hicimos más de 14 pruebas. Entonces ahora que ya la tenemos, nosotros esperaríamos pues ayudar a la población en general, ¿verdad? Para que pueda tener un diagnóstico más temprano.
A sobering update on Zika today.
It's the first time we've had a virus spread by a mosquito that could cause a birth defect.
Anywhere that this particular kind of mosquito goes, which is as far north as New York and as San Francisco, it's going to be very prevalent here in the United States starting next month.
With reports like these, it's easy to get swept up in the Zika hysteria. But how much of this is over-exaggerated? Well, first off, let's take a look at what we know. This is the predicted range that the Aedes aegypti, the Zika-carrying mosquito, can travel in the continental United States this summer. According to the CDC, the virus does have the potential to affect more than half of the continental United States. But that's not to say that half of the US population will contract the virus. The number of confirmed contractions in the US will most likely be low, and 4 out of 5 people infected with the Zika virus won't even notice they have it. That doesn't mean the US shouldn't prepare. And so far, Congress is doing a poor job. Partisan politics held up funding for Zika while lawmakers left for summer vacation, despite pleading from federal health officials.
We need to act now to protect Americans, particularly mothers and babies.
Here's what the proposed $1.9 billion in funding would go to. The race to develop a vaccine, disease control, and education on the virus are all steps that any normal health emergency requires. But some of the more costly aspects are providing health services to low-income and pregnant women. It's crucial that a woman avoid contracting the virus if she's attempting to be or is currently pregnant. And the only way a health provider can tell if a pregnancy has been compromised by the virus is through expensive testing. This is a lesson that the CDC and US government could learn from quite an unlikely place. At a hospital in San Salvador, a laboratory has implemented a test that could be revolutionary in the region's fight against Zika.
Solamente le podíamos dar al médico si se tenía chikungunya o tenía dengue, porque no teníamos una prueba que cubriera todos los arbovirus como la que tenemos ahorita.
A patient who suspects that they have the Zika virus can come to the laboratory and give their blood. This blood is then combed over meticulously with a technique called immunofluorescence, which allows the microscope to detect various types of infections.
Entonces, es una prueba mosaico que se hacen 6 diferentes pruebas en una sola, que es dengue, los cuatro serotipos, Zika y Zika.
This test is a huge step in the country's fight against Zika. The ability to correctly diagnose Zika in its early stages gives a patient a lot of information.
Los síntomas son bien similares en todos los arbovirus, tanto para dengue, Zika. Entonces es bien importante el saber o el conocer qué es lo que a mí me ha dado. Porque, por ejemplo, Zika está bien relacionado con la microcefalia en los recién nacidos. Entonces, para una mujer embarazada es bien importante saber qué es lo que ella le ha dado.
However, the test doesn't come without its own set of downfalls. It currently costs $125 to have your blood tested, which equates to about 20% of an average Salvadorian's monthly salary. Regardless, it's exciting to see medical progress like this in a country that was and still is deeply affected by the Zika virus. There are still many unknowns regarding the Zika virus's potential impact over the next few months and years. There are a few indications that the fight against Zika may be a winnable battle. Clinical human trials are beginning with a new vaccine. The World Health Organization is cautious but optimistic that the Olympics in Rio will go off without a Zika problem, and the US government is getting closer to reaching the $1.9 billion in funding. However, in El Salvador, the country has deeper-rooted problems that are only amplified by the rise of the virus. The country shows no sign of changing its abortion laws, or its laws putting women who have miscarriages at risk for murder charges, which spells trouble for pregnant women in El Salvador who may have been infected with the virus. The country also needs to find a more cost-effective way to diagnose the virus in its population. In the end, we've seen how much of an impact the mosquito has, responsible for several million deaths a year. It remains the deadliest animal on Earth.